like to introduce you to Dr. Jamie Peyton, the Chief of Integrative Medicine Service at UC Davis, who has a unique technique that's helping animals heal from burns. And we also have with us Curtis and Mindy Stark and their wonderful dog, Olivia. So I'm going to have each of them just say a few words, and then we'll just open it up for questions.
Great. Well, thank you so much. I really thank you guys for tuning in and coming to listen to our story, because it's always really important to kind of tell what we've done here at UC Davis, what we're doing, and what we hope to do in the future. All the fires in the past few years have really affected so many people, but also all the animals as well. And that has really been inspiring to myself and to others on our team to think outside the box and to really push the boundaries of veterinary burn care, because there is not a standard of care for animals in actually treating burns. And that's something that we're trying to establish and really advance this care. So with the campfire that occurred and being so devastating, of course, here at UC Davis, we took several animals in and treated their burns here. But you know, I knew that closer to Paradise in Chico and in Gridley, a lot of veterinary clinics were treating a large number of patients, hundreds of burned animals, and some of these quite severe. And so I wanted to reach out to these clinics and bring some of our new techniques and our way of thinking using human medicine and what they know for treating burns in humans to treating animals. And so I reached out to several of the clinics out there, one of them being VCA, Valley Oak Veterinary Center, because they had been seeing over 500 burned animals, and a lot of these quite severe. And I reached out to them, and they were gracious enough to allow us to come and try to help some of these really severely burned animals and work as part of their team. So myself and my students went out there, and it was an amazing experience, because we were able to work with so many, not only the VCA team there, but also other volunteer veterinarians and other technicians, to assess all these animals, talk to each other and educate each other about how we can treat them better. And then, of course, using these new techniques to help the really severely injured. We incorporated all types of different techniques. So the number one thing for people and for animals with burns is, of course, pain management. It is very painful. And we wanted to use pain medication we use for people, both injectable and ones that you give by mouth, but also looking at other techniques, blocking the nerves that go to feet that are burned, using topical ointments that are new to veterinary medicine, and then using other things to help with pain and wound care, like acupuncture, cold laser, pulsed electromagnetic field therapy, all these things to help the patient's pain and healing. And then, of course, one of the missing things we've had for veterinary burn care is a dermal substitute. And what I mean by a dermal substitute is, think of it as, you know, with these burns, you lose your layer of skin. And so a dermal substitute is like a fake skin. It covers those areas and provides pain relief and protection and the ability for the skin to heal better, your own skin to heal better. And so this is something we have not been able to use in veterinary medicine, but is very commonly used for people. The limiting factor has been, of course, the cost. So what's available for human medicine is very cost prohibitive. It's too expensive for us to use in veterinary medicine. And I always take a challenge face on. And so we came up with using a different type of dermal substitute, and that would be the tilapia skin. So creating a biologic bandage, in essence, using this fish skin. And the goal with that is to, of course, help with pain relief, because it covers those nerve endings and provides a lot of pain relief. In addition, helping prevent infection, helping to allow the wounds to heal. So think of it as like a jungle gym of collagen, essentially, that allows skin cells to grab onto that jungle gym and move across a little bit better, so to heal faster. And that really is the goal. The other benefit to using this type of treatment is, one, of course, the pain relief, because when we have to change bandages every day, it is very painful for these patients. And the advantage of the Tilapia biological bandages is that we don't have to do it every day. We can stretch it out to 3 days, 7 days, further down the line, even further than that, up to 2 weeks. And so that's a great advantage. In addition, if you think about how, treating 100 cats and doing 100 cat, and dog bandage changes every day, it's a lot of manpower. So that was another advantage during this crisis. So at VCA Valley Oak, we actually did 6 dogs and 6 cats that had severe burns in multiple areas. We've also treated an additional dog at Milbrant Veterinary Hospital in Gridley that was severely burned, and all the patients are doing quite well. So we've been very pleased with the response. And I think, for us, the main response that we're looking for early on is that pain relief, that change, that they can start feeling, happy about life. And especially for animals, it's all about quality and giving them the ability to feel better and, help their families, because they are a family member. And so it's been very rewarding to see the response. We've currently treated over 8 different species with this technology and this treatment, and they've all done quite well with no apparent side effects. So we're very encouraged about the response that we've seen. But even the bigger picture we have right now is to continue our work in advancing veterinary burn care. Here at UC Davis, we are really pushing and aiming to be a leader in this area because it has not been investigated. And I think that we can definitely be that, academic force to help the community, to help other veterinarians, and to really change how we're treating these animals for the better. And so right now we are looking to continue our work to develop the UC Davis Global Veterinary Pain and Burn Care Center with the help, hopefully, of people that are interested in helping supporting this endeavor. But it has been quite a journey and really rewarding, especially seeing the recovery of patients like Olivia and how much that she means to her family. So my few words turn into a few more, but I really appreciate everyone listening to what we're doing.
Okay, well, I think Olivia's had 3 weeks that I would never want to have. I will say that. We really want to thank VCA and UC Davis for all they did. She's made a remarkable recovery.
I would just comment that we actually thought she perished, and when they found her on the 6th day, we were so amazed and then so afraid because of how injured she was. And we were, really thankful that the local VCA hospital took her in to treat her, and she had huge sutures and gauze and wrapped legs and started off kind of like a mummy and very restricted physically. And of course, we gave her a lot of pain medicine because she was hurting. And about 3 days later, we got a call from Dr. Spencer saying that you were there and had selected Olivia for the tilapia transplant, and very exciting, or skin graft. And oh my gosh, that day when she came home, she turned upside down and did like a somersault on the bed. It affected her pain like relief so much, and not having that other gauze and sutures hanging and restricting her. And so we're so thankful. We just appreciate it so much, what you did, for her. And she's on her way. We can see her. She's definitely back. Her personality's back. So much happier.
It's amazing. Do you guys want to ask questions? We do have a question from Facebook.
Go ahead.
Dr. Peyton, does the tilapia skin get absorbed or does it disintegrate on its own?
That's a great question. So it depends on what phase phase they're at as far as the tilapia is, like I mentioned, this dermal substitute, so like a fake skin. So it's interesting, what we've been seeing is early on when the wounds are very severe and there is absolutely no skin, over time, it starts disintegrating because it starts sort of absorbing some of the fluid that's there. But as the wound starts healing, it actually will adhere to the areas that have some skin developing, and it will adhere, and we leave it on until it falls off, and it will fall off when the skin is fully healed. So it's pretty interesting. It gives us an indication of how the wound is doing and at what phase of healing they're at.
And I'd like to say that Olivia also likes the taste of tilapia.
She does.
She ate some of the skin, which thankfully doesn't hurt her, so that's good. But
yeah, well, that's also the benefit. And of course, when we developed it for the bears, that was the goal was that if it is eaten, which is a problem with a lot of bandaging materials, and when you eat it, it is not good for them and can cause a problem. But there was a part that was out further, and she definitely thought it was really tasty.
Nice little smell.
Yes.
yeah.
One more question from Facebook. How did you get the idea to use fish skin?
Yeah, so that's a really good question as well. It's interesting how life works. I've always had an interest in wounds and especially pain management. And, we have been thinking about using a dermal substitute. As I mentioned, the dermal substitutes are so expensive. And so I'd been reading different articles, and I saw that the group in Brazil had been trying to use tilapia for people. And I thought that was brilliant because it is easily sourced. We can use it as a byproduct. We have been in contact with them, but we decided, well, that is for people, but we wanted to design it for animals as well. And so we developed the protocol and the use of this particular tilapia product for the animals. Yeah, that's fine.
Great. Thanks.
Fabulous.
Fascinating story, though.
I know, right? That's what I think too. Well, and especially we've seeing Olivia's response, like that change, that day when you put it on is what is so inspiring to me, because
I couldn't believe it.
It is so painful. And in fact, some of her burns weren't third degree, they were more second degree, but even second degree can sometimes be more painful because some of the nerve endings are there. And
It was like night and day.
that's what is
She
so
always
inspiring.
loved to roll over on her back and put her feet up and would scratch her body. And she hadn't did that obviously for a couple
Yeah.
a week or week and a half, and then that first night she did that. So.
She couldn't hold it in. She was so happy.
That's what it keeps blowing my mind is just how much better they feel. And that's why I feel so passionate about changing how we've been treating them. Because it is, for years we've been using the same treatments and not varying. But there's so much out there when we look at what we're using for people, and why wouldn't we use them for animals? Why shouldn't we? So.
I'm sure we're glad you picked her.
Yay! Oh, how could I not? She's adorable. And she was just like, oh.
Very chill. It's exhausting.
It is exhausting being in the spotlight. I know, Olivia.
So the difference between the tilapia skin, say like the tough skin that you put on abrasions and stuff, you peel off and stick it on.
Mm-hmm.
That the gel type stuff.
Yeah. So this is different in that it's biologic. So they've done studies looking at kind of artificial bandages,
Sure.
and then biologic bandages, and it just makes sense. I always say nature has some of the best solutions, and when you put something that is more natural on those areas, they've shown in research that it has better results. And it makes sense because it has more things too, right? Exactly, and we don't know all the components yet. That's the next step, is to look at some of the components that we're seeing benefits, like some of the antibacterial, anti-inflammation. But the tilapia skin is very thick, and so it provides a lot of protection. And then we know that collagen. So it depends on the area.
Or
So.
just stick naturally.
All of those. So sometimes we create literally a Band-Aid. So a outer plastic with the inner creating the little, instead of the padding, we'd actually use tilapia. The other benefit would be the other way we do it is actually suturing it or stapling it on. Olivia had both of those happen, and then some areas it will actually adhere. And she also had areas that adhered too. So it really depends on the location and the stage of the wound.
Has this been used on dogs before?
So not here, not in the U.S. We had some tilapia when I went to England that we used on a dog that had a non-healing wound over there. But we've never used it before on burn wounds. So these are the first dogs and cats that we've used them for burn wounds.
How many dogs were treated with this again?
We did 6 at 6 at VCA because we picked the most severe ones. We treated other ones, but these were the ones we picked to use the tilapia bandages for. And then we had one that we are actively treating right now over at a different clinic. And then we're also treating a bobcat, which I forgot to mention. But we're treating a bobcat right now with Gold Country Wildlife Rescue.
And that animal was burned also, the bobcat?
It was, yeah. It has severe burns on his feet, actually full thickness all the way to the bone. So this is severe. But he's doing very well. We're very encouraged with his rapid healing and his pain control. He's acting like a normal cat. So it's pretty exciting.
We did have a question from Facebook. Does it work well on horses also? I want to talk about the different animals this has been done on.
Oh, sure. So as I mentioned, we've done it on about 8 different species now. Bears, the mountain lion, now the bobcat, pigs. We've done owls, dogs, cats, and now, yes, horses. We've done this therapy on 3 different horses. They've not been burns. They've been actually non-healing wounds. So, yes, the horses seem to be doing really well. Our initial data has shown that there's been improvement in these non-healing wounds. So, very encouraging.
Pigskin's been used often, though.
So pigskin is used very commonly in people. Yes, that's correct. But we haven't used it as much in animals. And a lot of times people think that you can just pull skin off a dead animal and use it. No, there's definitely processing that goes involved in it, and so with that has come a lot of cost. And one of the things that I'm passionate about is not only developing these new novel techniques, but making them available, making them accessible for veterinarians, so that we can use them on our animals and not feel so encumbered by the price. Anything else? Question? Oh yeah, it's nice. That's okay. I'll take it. After all the fires, we'll take the rain. I'm okay with it.
I have a microphone with all of you.
Okay, perfect.
And then talk to you guys afterwards.
Sure.